Hi, I'm Dr. Scott Santamore.
And I'm Dr. George Rogu. We're both from RBK Pediatrics and Urgent Care.
So thank you for taking a few minutes to join us and watch this video. We just wanted to go over some of the things to expect when you come back to us for your 6-week-old visit at RBK with your newborn. So first things first, when you come on in, we're obviously going to catch up on how everything's been going since the last time we saw you. We're going to ask if you have any questions, concerns, anything that's come up that you wanted to know about, anything you wanted to talk about specifically in the office there with us. Of course, we're going to check the weight again. It is still by far the most important thing we look at in these newborns. Checking the weight is really the only and the best way to determine if they're getting enough calories to grow and develop properly. We stay paranoid about the weight all through your childhood. And so we're going to go over these curves every time you come in. We're going to review the developmental milestones, and we're going to address any other needs that you and your child may have. We'll also go over any vaccinations that they need, and of course, answer any questions that you have about all of that stuff. And of course, at the very end, we'll help you schedule your next appointment with us.
Now, for caring for your 6-week-old, we'd like to share some anticipatory guidance about feeding, safety, and so forth, and child's behavior. So I guess some developmental and behavioral issues that you'll see with a 6-week-old and things that you need to do is you need to put the baby in a crib awake, drowsy to help with the transition. You should try to keep the room nice and warm, comfortable temperature. The feeding habits for these babies should become a little bit more predictable. When the baby's crying, try to stroke the baby's head with gentle rocking to soothe the baby. Never hit or shake the baby. We know sometimes these babies make a lot of noise and they're cranky at the worst times, but we have to be very calm. You can start a little bit of tummy time when the baby's awake under supervision. The reason that is because sometimes if you put the baby on its belly unsupervised, the mouth and the nose can mold into the mattress, and we could have some trouble with the baby's breathing, and you never know about sudden infant death syndrome in these babies. If you need to take the temperature of these babies, do it rectally, not with one of those scans, and wash your hands often so we prevent the spread of viruses. Dr. Scott, maybe tell us a little about nutrition and feeding.
Yeah, so again, by far the most important thing we talk about with these infants is the feeding, getting all of those calories into the baby so that they can grow and develop properly. So the advice at this age is still to just feed. The babies need all of those calories they can get. So continue to feed every 2 to 3 hours, including overnight. You don't have to wait for feeding cues or anything like that. Always go and offer the baby the formula or the breast milk. There's no set amount to feed your babies. You feed them as much as they'll take. Remember, the worst thing that happens if we feed the babies too much is they just spit up the extra. No big deal. If we feed the babies too little, they don't get enough calories to grow and develop properly. So feed. Babies who are exclusively breastfed, the recommendation is to give them an extra vitamin D supplement. Helps with the bone growth and development. If the babies are taking any amount of formula, we can put anything we want to into the formula. So that includes all of the extra vitamins and supplements and minerals and everything. We do not need an extra multivitamin supplement on those newborns. Remember, if you're formula feeding or breastfeeding and pumping, store the breast milk and the formula appropriately in the fridge. Of course, following the directions on the side of the cans there. Always feed the baby in a safe position, never on their backs, always held up in an upright position, and always just monitor for any trouble breathing, choking, spitting up, and all of that kind of stuff.
So the most important part is the vaccines. What vaccines do we usually give at this age, Scott?
So we typically start with 3 vaccinations. 2 of them are shots, and 1 of them is a little drink we give the babies by mouth. The 2 shots are against the bacteria called Hib, the bacteria called pneumococcus, and the little drink is against a virus called the rotavirus. What can they expect from these vaccines, Dr. Rogo?
Yeah, the vaccines of today are pretty technologically advanced. They've been around for a million years. Sometimes you might see a baby that's crying a little bit, maybe a little fussy, drowsy, maybe a little decrease in activity, maybe some diarrhea even. But most of the time, it's just okay. They do prevent significant illness that we'll show you some pictures of later. And we can always give you the vaccine information sheets when you come to the office. They'll give you a whole lot of information on it. We did forget to talk about some safety tips that we should share with the parents when they come in.
Always safety first, by far, and very, very important. So just some good standard safety advice for the babies. Firstly, with the sleeping, we always put the babies to sleep on their back, never on their bellies. Sleeping on the bellies has been associated with the sudden infant death syndrome. Likewise, make sure the little crib and bassinet is clear of any loose blankets, the stuffed animals, anything that can become a strangulation risk to breathing for the infants. What's your advice on giving baths to the babies?
Well, babies they don't get that dirty.
Yeah.
Once every other day is perfectly fine, but be very careful when you bathe them. Never just leave them there because they can't really move much, and if you leave them there even in a small amount of water, they can drown. So under supervision all the time.
Yeah, we call them accidents because we don't intend for them to happen.
Correct.
All right. So thank you guys for taking a few minutes.
We forgot to show some of the severe illnesses that the vaccines do prevent. So as you were mentioning, we have Haemophilus influenza, which I have seen in my career, causing periorbital cellulitis, which is the lower left-hand corner of the screen, meningitis, which is significant bacterial infection, epiglottitis, which is inflammation of the airways and the children cannot breathe, and ear infections, which we see less and less of because of the Haemophilus influenza vaccine. And the pneumococcal vaccine, again, another vaccine that prevents meningitis, blood infections, and we have seen a significant decrease in the amount of ear infections since we started giving these vaccines. So below, we see a great number of pictures of severe illnesses, which Dr. Scott, you're a younger physician. Have you seen many of these cases?
No, not at all. In fact, when they taught my class about some of these vaccines, especially the Hib, they taught us that previously these were the most common causes of these things. We don't see them anymore thanks to these vaccines.
Unfortunately, I grew up in the time of doctoring where we still did see these illnesses, and they were not pretty diseases. Many times we treated the children and we saved them, but there were unfortunate situations when the treatment was too late. We don't want to do that, and the way to prevent these diseases is by vaccinating accordingly.
They are safe and they are effective. And if you have any questions, don't hesitate to ask us.
All right, so we're going to be signing off. We're from RBK Pediatrics. You can visit our website, rbkpediatrics.com, or give us a call at the office, 631-499-4114.
We're looking forward to seeing you.